Thanks for tuning in. Yeah, I think one of the main things that people want to know is what got you interested in functional medicine. And one of the things that really got me interested in functional medicine was seeing how certain patients require more customization as far as their diet. I remember visiting functional medicine holistic practitioner back in Phoenix, Arizona, about 20 years ago, and he was doing a lot of things with customizing people's diets based on their food sensitivities, on how they reacted to, excuse me, sorry, on how they reacted to different foods, and how foods caused inflammation and imbalances in their system. And I was very intrigued by that at the time. I was very taught very conventional medicine. A pill for an ill. If you're sick, there you have to take a pill or something. In that nature. I just got out of residency, and that was back in around 2002. And I went and visited this guy, and I actually he was he was a naturopathic doctor, which is very common in the West Coast. So we don't have much of that here in Florida. And I visited him, and I was very intrigued. Stuff that I had never been taught in medical school, and it just opened my mind to all these other possibilities and therapies and things that we could do for patients. And I followed him for a whole week. These are the kind of patients that I saw what he was doing with his patients, and it's something that I had never even thought about doing with my patients in internal medicine. And what he was doing, it was particularly testing their blood to see which foods were causing problems in inflammation. Inflammation is basically one of the main causes for a lot of problems in people. Weight gain, hypertension, anxiety. When we have inflammation in our brain, we also have inflammation in our brain, and just causing all kinds of imbalances, including hormones. So I saw these people get better in so many ways. And on top of them, he also found that he used a lot of supplements and nutrients to help bring down inflammation and help them with their a lot of their symptoms. And I noticed that these people were telling me that they were becoming less um, dependent on medications. A lot of them had stopped taking blood pressure medicine and cholesterol medicine. And the way I was taught in medical school was, once you start these medications, most patients die with these medications, or they have to stay on them. But it made me realize that, lifestyle modifications, teaching patients how to eat is a huge component of getting people well and bringing down inflammation. And I saw these people eliminate certain foods in their diet and incorporate different ones based on their results on their blood, and they were getting better. I mean, and so that's how I started. That's how I started my journey into like diving deeper into the patient's needs and what is it that's causing problems. And I was very, and it just changed the way I practice. So it was very, very eye opening.
Hey, Doc, you mentioned that one of the biggest things that you notice is, or is how we eat. It has a dramatic effect not only on our weight, but also, you mentioned inflammation and other areas. Uh, with all this food education, and you're supposed to eat healthy from school into your college, why you think we still have so many problems?
Yeah, I think there's a lot of confusion out there, and people, sometimes they're told, oh, you got to eat more fat, you got to eat less carbs, you got to eat more protein, you can't eat gluten, you can't have this. It's very confusing for the even for the most medical doctors, and that's why I think it's very crucial to have patients blood tested to see which foods their immune system is reacting to. And I think this is one of the main reasons why I'm seeing a huge um, numbers of Hashimoto's, what we call antibodies to our thyroid. Our immune system is attacking the thyroid and causing a lot of problems with thyroid. I used to, when we first started testing for like thyroid antibodies, you know, and usually that starts out because of inflammation that's usually caused by leaky gut. Foods are getting through partially digested foods that shouldn't get through your lining of your gut or your intestinal walls are getting through, and it's causing the immune system to get confused because they're not normally seeing those agents. And then it causes your immune system to go rogue, just starts getting confused and cross-reacting. Some of these proteins and particles that get through are going to cause sort of that are very similar to certain things maybe in your some of your own tissues, and it causes an attack on your own tissues in your immune system. So that's what really turned me on to these things, and I've noticed more and more that this has become more of an issue where people's thyroid has become a big problem. Um, when we talk about thyroid, the way we test it in functional medicine is we go a little bit deeper into the different types of thyroid hormones. There's thyroid T4 and thyroid T3. That your body has two different types of thyroid. Thyroid is primarily made in your T4 is primarily made in your thyroid, and then your body converts it to T3, which is the active thyroid. But it doesn't do that conversion if there's hormonal imbalance in your system, or there's inflammation, or there's nutrient deficiencies. If you're deficient in certain nutrients, you don't make that conversion. Like the enzymes don't do that, and then ends up being converted to something called reverse T3, which is an inactive form of T3. And that's when I see really high levels of reverse T3 versus actual T4 to T3. I know something's going on with the body. There's a deficiency in nutrients or hormonal imbalance. And when I see an elevated reverse T3, that tells me that your body's trying to conserve energy because it's not ready for the task. It's not. And I see that with a lot of these mitochondrial dysfunction, where the mitochondria are the little cells inside they're little organelles. They're little things that process. I call them the furnaces, for your body. They make the energy inside the cell, but they're usually under a lot of oxidative stress, which means a reactive oxygen species, where chemical reactions happen to make energy, and they become basically like if you bite an apple and you leave it out, it turns brown. The same thing happens inside the cell. And when that happens, it causes a problem even with the thyroid, with conversion, So it's intriguing, And then on top of it, with our panels, we also look at thyroid antibodies, because if those are elevated, those antibodies get in the way and don't allow the thyroid hormones to hook up to the cells, the receptors. So they get in the way too, and they cause problems with thyroid dysfunction. So I see a lot of people that most practitioners that are not functional medicine only look at a TSH. TSH is just a marker in the brain that, your brain sees when your thyroid is low, and it pushes high TSH to try to stimulate the thyroid to make more thyroid. But unfortunately, we only look at the TSH. We're not really looking at what's going on with the rest of the thyroid. And so we do more of an extended panel on the thyroid to exactly see what's going on. So you can get so much more by doing a functional approach to thyroid testing just from that. So that gives you an example how testing for functional medicine is a little different. We look at ratios, we look at other components that can affect the things like the TSH in our case with the thyroid. And when I see somebody with elevated thyroid antibodies, it already tells me that their immune system is attacking their thyroid, and I know I need to work with them as far as leaky gut, working on the inflammation. And generally that starts with your diet, because 70% of your immune system is all along your GI tract. So if your GI tract sees things that are kind of, foods that you eat on a regular basis that are processed, that are chemicals, toxins, or things that you shouldn't be eating, processed food, it starts turning on this inflammation, and then eventually turning on your immune system and causing a lot of autoimmune disease. I'm seeing a lot of that.
It sounds like your functional medicine approach is a more in-depth. Your tests are more specialized. There are different types of tests that other regular doctors are not doing. And all starts, if I understood correctly, if I go and see you, it all starts with the right blood work.
Oh yeah, I mean the blood work. I look at it as instruments for a pilot. The pilot he can fly a plane without instruments. But the instruments make everything more precise. It's just half the battle. So I start off with a very good intake. As far as a physical. Most of it is in the history. Well, what was it like when you were in high school, in college? What's it like right now? What's the progression of somebody's life? What have they been through? Have there been traumatic situations in their life that's changed the way, their body functions. And so we go a lot of it go into a very in-depth history and physical is what we call. But mostly physical history. You get a lot just by talking to the patient. And once you put that together with the blood work, then you're able to come up with a specialized program or a tailored program for that patient. And that's the good thing about functional medicine is that it requires extra time, and extra testing, and unfortunately, most insurances don't cover everything. When it comes to the extended amount of time that is required to come up with a customized program for somebody and find out what they're missing and put that into the mix. It's basically a cooking recipe. If you're missing a couple things in there, you're still going to get good meatloaf, but it's not going to be this, awesome meatloaf unless you're missing a few things, So you're not going to get a finished product that is going to be like A plus, So that's the way I look at it. Or like as we always said, like a symphony, like orchestra, one instrument's off, something else gets thrown off, So it's a beautiful thing when you can give the body what it needs so it can fix itself, and not just take another medication. So medicines are important. Let me tell you. That's still my main part of my practice. But it's what is it that got us to having to take this medicine? Because you weren't taking this medicine in your 20s when you were in high school and you felt great. Something happened during the timeline of you developing this problem. Not everybody developed high blood pressure overnight. Something happened. And so that's what happens with functional medicine. We're trying to find out what happened, what caused the problem, and let's fix it instead of let's just give you the medicine, or put a Band-Aid on it and just forget about it and keep taking more medicine. That's what functional medicine is. And that's what people sometimes don't understand when we have to take extra time, extra testing. And sometimes, unfortunately, insurance doesn't cover, the extra time and the extra testing, So, but we try to work with people, and see where they can, we can try to meet halfway and try to help people, as much as we can. And that's what's good about my office, New Age Medical Center. Since we're primarily internal medicine, but we've added functional medicine to it, we're able to incorporate both. So it makes it much easier for the patient. That way they don't have to go to see a functional medicine practitioner outside of insurance and then still have their primary doctor. And now the primary doctor is really not knowing what the functional medicine doctor is, and they don't put them together, So the patient's caught in the middle. Oh, but now they don't know what to do, or now he did testing that this doctor already did, so it's unnecessary testing, or this doctor, why is that doctor doing this, or why is he trying to change your medicine, and why is he putting you on these supplements? The beauty with us is that we can kind of incorporate all of that. Even if you already have another functional medicine doctor, as a primary doctor, primary care doctor, I can understand what that functional medicine doctors do. So, I'm not trying to say I'm going to try to do everything, but if you already have one and you need a primary doctor, a lot of functional medicine doctors don't want to do primary care or deal with insurance. So we're able to do both. And then that's why we're trying to work on a program where we can do a sort of a membership program for people that want to do both, and so I'm open to any ideas. But that's my vision. That's my goal, and I've seen it, work in a lot of different practices, and I think we could do great things,
Doc, I'm glad that you touch on the problem that some of us have when we visit one doctor and then we visit our primary care doctor and then we go and visit the specialized and then we come back and them two are not talking to each other and we're caught in the middle. And that's a great point to highlight from your practice that we have the best of both worlds under one roof, that's great for a lot of people. Let me ask you, doctor, what is you mentioned about misconception and some mistakes or some errors that people believe about functional medicine. What is the one that jumps to mind right away when people come and see you about misconceptions that has to do with misconceptions of
I think
functional.
some people, when they come in, they think it's like holistic medicine, kind of like voodoo. Like, oh, he's just, put some kind of weird combination of things together, either hormones or like, supplements or herbals and things. But what's nice about functional medicine is we're not guessing, we're testing, and we're testing based on what we think we need to test from your intake, from your um, basically from your history. Somebody comes in and tells me they're having weight gain, anxiety, depression, hair loss. I know something's going on either with their thyroid or their sex hormones. I'm going to definitely test those things. And I'm going to check the full panel, not just the regular TSH. I'm going to check the T4, T3, reverse T3, and thyroid antibodies. I can get so much information just with that. Just from that, I can also tell if there's something going on with cortisol, which is stress hormone. Now I can see why that cortisol is affecting the thyroid. You're not converting the full active thyroid because of cortisol, or I can check a B12 level or an iron level. I'm seeing a lot of iron deficiency. That's another reason why the thyroid's not working ideally. So that is why I believe that functional medicine, the way we practice, it's precise, tailored, customized medicine. So it's not, oh, he's just a quack because he's ordering all this stuff that they're not used to, like getting or hearing from another doctor or the conventional, therapies, which, we're basically giving the body what it needs based on the testing and the physical, history and physical. So it's not considered holistic. I don't know holistic is, we're getting away from using that and we're actually going more into functional, because with functional we can even do more precise testing on saliva, urine, hair, serum, whole blood, so many different ways that we can find deficiencies that are appropriate. So not just the regular blood work. So it's just very fascinating that, and this field is just changing all the time. Right now, to tell you how legit this functional medicine is Cleveland Clinic right now with Dr. Mark Hyman. He's a medical doctor, conventionally trained. He started a whole program, a whole department of functional medicine, and it's coming from Cleveland Clinic. And we're following suit with Mayo Clinic. So you know that this stuff is for real. It's unfortunate that insurance companies haven't, like, eventually they will, where they'll cover more services that are covered by a functional medicine practitioner once it becomes more like mainstream, and there's more. But yeah, I'm excited with this is the future of medicine, is functional medicine.
Doc, I like what you say. I took notes: precision, tailored, customized medicine, giving the body what it needs.
Absolutely, yeah.
I love it. I love it. Anything else you would like to add about functional medicine that we haven't talked about?
No, I think that's I think the just kind of giving you guys an idea of how I practice functional medicine and why my practice is unique, and how I got introduced to functional medicine. I actually went and followed a naturopathic doctor on the West Coast. Actually, well, he was from California, but then he was practicing in Arizona. And I was just like, man, this is amazing that you can actually help people without using medicine. I thought when I got out of training, back then, it's actually changing now because they're incorporating even functional medicine now in some of the medical schools, including locally. We have University of South Florida, Dr. Pamela Smith, medical doctor from the Institution of Anti-Aging for A4M. I'm forgetting but she is, and that's where I did my training, for my functional medicine. And I'm digressing a little bit. So it's just amazing how we can help people, with functional medicine. So I'm just giving you sort of a synopsis of how I got into it, how I've progressed with functional medicine, and how I incorporated that into my practice, and how we can really help people, give people more options, give them empower patient to help themselves, and not just be totally dependent on medications. And again, I totally agree. Medications are needed until you change your lifestyle, until we find out what caused the problem.
Love it, love it. Giving the patient more options and empowering the patient with more options. Before we started talking about functional medicine, we were talking we were sidebar about the next Facebook Live, and if I'm not mistaken, we agree it's going to be at 6 p.m. next Monday. Just to let everybody know that is watching this video.
Yeah, I know we've been trying different times. You know, it also depends on my schedule because there's sometimes days where things get a little crazy in the office, and it's hard to stick to a specific schedule. Sometimes I get called in to do certain things with patients, but in general, we try to do them every week. We try to do them every week. Close to either Monday, Tuesday, morning or evening. Yeah, I'm willing, to be flexible as long as you guys are. Yeah.
Awesome.
But a lot of these videos are being archived, right? They're in the system.
Yes, sir. So we are uploading them on the YouTube channel. So just in case that you didn't know, New Age Medical Centers, for you watching this video, we have a YouTube channel where we archive the long form videos, and then on Facebook you will find the snippets, the questions, and the short videos that you can consume really fast. With that said, if you have any questions about functional medicine, please leave a comment. We'll make sure that we will send those questions to Dr. Moreno. And if you would like to schedule an appointment, you can send a text or call 352-596-9095, or go to online. If you don't want to talk to anybody, just go online to New Age Medical Center and you can request a telemedicine straight from the website. Anything else that we're missing, Dr. Moreno?
No, I think that's really good.
Okay, awesome, guys. Thank you for watching, and we'll see you in the next one.
Thank you.